I'm Dr. Atul Verma. I'm MCH Neurosurgeon. Today I will be discussing about glioma. So basically, our brain is made up of different type of cells. There are neuroglial cells, which are commonly astrocytoma, oligodendroglioma, microglial cells. Because of the proliferation of these neuroglial cells, there is the development of glioma. These are cancers, basically the brain tumors of the brain. And out of all primary brain tumors, about 25%, about one-fourth of the tumors are gliomas. Basically, there has been a lot of study about the primary causes of the glioma, but nothing can be found significantly. But regarding the development of gliomas, in high-grade gliomas, the ionizing radiations to the previously low-grade gliomas can cause degeneration of these low-grade gliomas and develop into high-grade gliomas. So basically, this ionizing radiation can cause degradation of the tumor. The gliomas are basically graded from grade 1 to grade 4, whereas the glioblastoma is already an invasive high-grade tumor, which is already in a grade 4. It has got a very short lifespan, even it is less than 2 years in many cases. So glioblastoma is more aggressive compared to gliomas of grade low grade and high grade glioma. As the gliomas are present throughout our brain, our brain is made up of different type of cells. These gliomas can be present throughout our brains. Depending upon the part from which they arise, it usually causes symptoms from that part. Like from a frontal lobe, it can cause mental alternation. If it is involving the speech area of our part, it can hamper our speech. If it is related to the motor strip of our area, it can affect our motor. Weakness of the limbs can occur. If it is from the sensory part, it can affect our sensory systems like tingling and sensation or diminution of the sensation can be seen. Numbness can be seen. Apart from that, the mass spectrometry itself cause many symptoms like nausea, vomiting, headache, neck irritations, and limb weaknesses can occur in these cases. Initial test for a quick diagnosis, we can go for CT scan of the brain, which can show a space occupying lesion in the brain. Apart from that, if there is edema or bleeding is there in the tumor, we can quickly identify about the glioma and the tumors of the brain. For very specific, we go for MRI imaging of the brain. Different sequences of the MRI imaging help us identify the different types of gliomas, grading of the gliomas, location of the gliomas, how malignant it is, we can make out on these scans. Whenever glioma is diagnosed, always it's most of the time surgery is preferred depending upon the age of the patient, state of the patient. Always surgery is preferred in these case of tumors. But if it's already very malignant and when surgeries are not possible, then the chemo radiation and radiation therapies are given in these cases. Surgery is has a good outcome in case of low-grade gliomas. Usually, gross total reaction or near total reaction, resection of these tumors are curative. Almost, it gives a lifespan of 10 to 15 years, low-grade gliomas. Whereas in high-grade gliomas, resection with the chemo radiation only can extend the life of 2 to 5 years only. So we have surgery, radiation and chemotherapy as a management of these gliomas. Usually, these gliomas, as because these are involving the part of the brain, patient already have a deficit of some type whenever these gliomas are present or they are presented to a doctor. Usually, these have some type of neurodeficit. Apart from that, these radiations have a cognitive effect. Apart from that, whenever the chemotherapy is given, it has a toxic effect on the body. Due to these side effects, the patient may develop symptoms accordingly. Usually, in low-grade gliomas, when there is a successful resection and a gross resection is possible, these gliomas may land up with some part of deficits in these cases. So the patient has to go for rehabilitation to improve their quality of life. So patient can live a good life with the rehabilitation. It extends the lifespan of a patient.